Hi, my name is Michael Benefield. This is my assessment of the peripheral vasculature and lymphatic system. This is for Albany State University for the BSN program. So we would start by assessing or inspecting both arms. We're looking for any abnormalities in symmetry, any lesions, any pulsations, any difference between the two. Anything that would bring up some sort of questionable circumstance. We would move on to palpating for a pulse, starting at the radial artery. We would palpate bilaterally on both sides, and we're noting the strength of the pulse. And I would give this patient a 2+, and that would be a what's considered a normal pulse. We would move on, and we would want to palpate bilaterally on both sides the ulnar pulse. Same thing, noted a 2+. And we also want to palpate bilaterally a brachial pulse, noting the same thing, a 2+. Lastly, we want to palpate at the epitrochlear region on both sides bilaterally, noting any abnormalities. And at this point, we could perform an Allen's test. And so what we would do is we would have the patient occlude both sides of the patient's wrist, both arteries, and then we would slowly let go on one side. The palm should turn from white back to red with about the same thing as what would be considered a capillary refill time. If they did not, then we could assess for any occlusion on the artery on one side. The next thing we want to do is we want to inspect and palpate the patient's legs. So we would obviously expose the patient's legs, and we're looking for any masses, any lesions, any abnormalities, any pulsations, any irregularities in symmetry from one leg to the other. We also, when we're doing this, we want to inspect for temperature. And we want to make sure that we're looking on both sides of the leg too, depending on how your patient is seated. So after we're done inspecting the legs and we have palpated for temperature on both sides, we want to take and we want to measure the calves. So we're noting any difference in between one side to the other because we're looking for symmetry in both of the patient's calves. So moving on to the pulses of the lower legs, we would start up here inspecting and palpating the femoral pulse. And we're going to go one side from the other, and we're going to make sure that there's no irregularities or difference from one side to the other, noting the rate and the rhythm with the femoral pulse. When we move over to the popliteal pulse, checking it, we're going to check it bilaterally on both sides. If we have the opportunity, we would ideally want our patient in the prone position to check it again while the patient was prone. And we would do that bilaterally on both sides. We want to move on to the posterior tibial pulse, and so we would check that also. And then while we're done, we would check that bilaterally on both sides. And after we're done checking that, we would move on to the dorsalis pedis pulse. Noting any irregularities, we would check that also on both sides. When we're down here on the legs, we also want to check for pretibial edema and noting any of that on the patient. And we'd also check the lower legs if we were looking for edema down here also. The next thing we want to do is we want to assess for color change. So we would raise the patient's legs approximately 30 centimeters. And we would note color change within the legs. Now, if we could get this guy up, the next thing that I want to do lastly is I would have the patient sit with their legs hanging off the side of the bed, and I would look for a return of circulation into the legs within about 10 seconds. That's going to wrap up the peripheral vasculature. Once again, this is BSN program, Albany State University. Thank you.